Dr. Guleria, you've touched upon this. You've talked about the international experience, countries like Italy, UK, Brazil. They hit a peak, then they suddenly dropped, the number of cases dropped. Is there an explanation for the sharp fall? Then months later, cases suddenly increased again. Is there?
So this is an interesting phenomena, and Brazil, of course, there are different theories now, because when Brazil had this huge number of cases, there was a feeling, and there was some modeling data which also suggested that they had possibly achieved the so-called herd immunity. And they said that the cases will no longer, there will be no longer a spike in the number of cases. That was proved wrong. And now the reason for that is being speculated is one, that there has been now a new variant which has emerged in that country, which is more infectious and therefore spreading more quickly and causing more number of cases. And the second, that it's possible that many individuals who had mild or were asymptomatic, who had mild or asymptomatic disease 7-8 months ago, that is during the first time in July, August, when they had the peak, their immunity has waned and they are now become more susceptible to a reinfection, and maybe that is why they're seeing a surge. I don't think we have a definite reason for why the surge has happened in Brazil, but these are the two theories which are there. There is definitely a variant strain circulating there which is more infectious, and therefore that is a cause of concern, because now we have a variant strain circulating in Brazil, in Africa, and in the UK.
That's right. In the UK, Prime Minister Boris Johnson had said that this new variant may be more deadly. The number of people who have tested positive for the UK variant of COVID-19 in India has climbed to 150. That's what the Union Health Ministry has said today. Is that a concern for us?
It is a cause of concern, because we know that this strain is highly infectious. And I would say that if we take that one step forward, it means that if this strain is highly infectious, it can also infect people with comorbidities, our elderly. And we know that even with the older strain, if the individuals who had comorbidities or who are elderly, if they got the infection, they had more severe disease, and therefore it would indirectly lead to more hospitalization and a higher mortality. Therefore, it's a cause of concern, because if a strain is more infectious, it will also infect the high risk group and those with comorbidities, who, because of the underlying comorbidities and their age, will therefore have more severe disease and therefore land up in hospital. And that is why I keep stressing on the fact that we should try, and everyone should come forward and aggressively get themselves vaccinated, because that will help in containing even this variant strain in terms of its rapid spread in our country. We should not take a chance that this could happen in the coming weeks.
So it only works if we all work together or take it together. So, Dr. Guleria, is there an explanation though for why COVID cases in India have fallen so much now and so suddenly? We went from 100,000 cases a day, now 15,000 a day. In fact, in Delhi, we're reporting about 200 cases, schools reopening.
Yes, I think it's a very remarkable thing. A lot of effort has gone in, but still it's something which one had not expected that would happen so quickly. I think it's something that one needs to really study and see. Is it related to the fact that we have some degree of inherent immunity that we've developed? The previous zero surveillance was not very encouraging. It did not show a significant degree of herd immunity. So I don't expect a very large degree of herd immunity in the population to have happened so quickly. It's also likely that we may have some degree of cross immunity because of our exposure. And we are a younger population, so maybe we are getting lesser illnesses. But I think this is something that we need to evaluate. Our cases have really come down, except for 2 or 3 states where there's still a large number of cases. Kerala is still seeing a large number of cases. But at a national level, we have done very well. And that is why we need to sustain this, because we should not really lose this advantage.
And given all those reasons you just cited, younger population, etc., is there a chance then that India, like Italy, UK, Brazil, etc., who saw those daily cases fall, that India could also see that sudden rise again, or no?
So that is the main cause of concern, that we may have such a situation developing, because the virus is something that we cannot predict. One had made a lot of predictions in the past, from the pandemic going away many months ago to the fact that we may have a huge number of cases. So it's very difficult to have a prediction, but we must be prepared for the worst. And what I am worried about is that we may have a resurgence of cases again because of some degree of complacency. and also because of the fact that there is this vaccine hesitancy. And that is why, like I said in the beginning, we have to really get people to understand the importance of getting themselves vaccinated now when the cases are less, rather than having a situation like UK is having, that people are now getting themselves and rushing to get themselves vaccinated because of a surge in the number of cases.